I'm talking about when I first became a minister. The major challenges, because when I asked the Prime Minister, what was your main problem in Kuwait? He said, my main problem was treatment abroad, because that's taking a large chunk of the budget for sending Kuwaiti patients to be treated in the foreign countries, like UK, States, Germany, France, wherever. So he said, that's my main concern. So I started addressing this problem. Why were they being treated abroad? The reason was, to start with, it was really a trend in that time. Not that we didn't have enough experts in Kuwait. No, we had enough experts, but it was a trend that started off by the MPs, members of parliament, so that they can get more votes in their constituency. They did all these favors to the Kuwaitis. So it was really an open-ended problem. I set up committees in the hospital itself of experts, and over these committees I set up a higher committee to supervise this committee. And we eventually decreased the treatment abroad by setting up these two committees, because they looked at the patient, they evaluated the patient, and then decided whether the treatment is available in Kuwait or not. So this was a challenge, and we cut down the budget tremendously for treatment abroad. The other area so that you can improve the treatment abroad was to bring experts from international institutions, and not just bring them to treat, because that wouldn't solve the problem. If you bring them to treat and they go away, you've not solved the problem. It's like giving a fisherman, if he loses all his gear, fish, instead of giving him a boat and fishing gear. So we decided to get international communities from Canada and the States and UK. So we signed contracts with McGill in Canada, Toronto in Canada, Johns Hopkins, and the contract was a very good contract, which meant that they needed to come here, give us a service, train our doctors, nurses, technicians, so that when they leave after the contract termination, we do have our experts who would take over the treatment abroad. So it was really fees for service. If they don't deliver, then they don't get their fees. And it's the first time that we ever had such a comprehensive contract with Canada and the States. The Canadians, for McGill University, was for the chest hospital, cardiovascular diseases. And the Toronto was for the cancer center. And these two were the main areas where people used to go abroad. So we really cut it down to a minimal. That was the first challenge. The second challenge is training our doctors for higher specialties. And with these universities that we made contracts with, we had slots for our doctors to train in Canada. We had 40 slots for Canadian graduates, and open-ended slots for fellowships, which is higher specialties. Because I think we should invest in our future doctors, and that's what puts up the standards. Then again, the other challenge was accreditation, because in order to improve standards, you need that our hospitals and departments get accredited. And again, we have the Canadian Accreditation Board, which we did a lot of work in, and we've got a lot of these departments being accredited for standards. Then the other one which I formed was the Kuwait Health Authority. The Kuwait Health Authority is an authority that would take the insurance for Kuwaiti people, because Kuwaitis didn't have insurance. It'll also take the IT, because our IT is deficient in Kuwait. We're way backwards than other countries. And it will also take the public health, and it'll take also the accreditation, and also under the Kuwait Health Authority would be the treatment abroad. So that the Ministry of Health can eventually concentrate on clinical matters, whereas all these others were an extra burden on the Ministry of Health. They would also take licensing of private sector. So this really was in the reform plan, and we cut a long distance in it. And up till now, I think since I left, we have definitely addressed these main problems. Any area where there is service for nationals, it is a major challenge. In our constitution, it says that health care should be given free to all Kuwaitis. And therefore, we are very proud of the national health system, which is like the UK national health system. It's a very good system because everybody gets treated free of charge. But once we make the insurance for Kuwaitis, then it will solve a lot of the problems in this health authority, because this health authority will be supervising all the important steps that the health ministry does. Because you can't have the ministry giving a service at the same time evaluating itself. This health authority will evaluate it and set standards. And therefore, I think it's a major step in the reform. This has to be passed by the parliament. The law has been written, completely finished, and it just has to go through parliament, and then it will be implemented.